Okay, so in this video we will be discussing about mastitis. Mastitis is of two types. It is going to be lactational and non-lactational. So mastitis is actually the inflammation of the breast. It will be lactational and non-lactational. In lactational one, what happens is that it can be bacterial or non-bacterial. Bacteria may enter the nipple through like a cracked or a retracted nipple. Once it enters, it's going to be start growing there. Or it also could be that the duct could be blocked through debris, and behind that there's going to be collection of the fluid. So once the fluid starts to collect there, it is very easy for the bacteria to grow there, right? And that's mainly the Staph aureus that's going to be growing there and leading to mastitis. So the signs and symptoms are, initially it is going to be with generalized cellulitis. There could be also a lump that's going to be formed. Alongside with that, there's going to be pain, signs of inflammation, which would be fever, malaise, and then also there's going to be difficulty in feeding as well. On ultrasound, there are two types of things that can be seen. First of all, the cellulitis is seen as the area of increased echogenicity. And also, if there's going to be pus present there, then there's going to be hypoechoic area that is seen within the ultrasound. Okay, for the management purposes, if it is bacterial, then antibiotics are given for it, which is given for around 2 weeks. Alongside with that, there's going to be breast support through garments. It could be given. Then cold compressions can be given, analgesia to actually relieve pain, and then aspiration can be done, and that pus can be taken for culture purposes, culture and sensitivity. And the last would be incision and drainage. If the abscess which has been formed is more than 3 centimeter and the pus present in it is going to be more than 30 ml, then there is going to be a suction catheter which is inserted. So there's going to be a suction catheter that is inserted within the abscess, and it is drained with the help of it. For non-lactational mastitis, we're going to be dividing it into 3. Periductal mastitis, which is going to be around the lactiferous duct. So the inflammation is going to be around the lactiferous duct, and it is seen, and the nipple retraction is also seen. So there's going to be a fish mouth like opening or a slit like retraction which is seen. So nipple retraction is seen in periductal mastitis. Then there's going to be granulomatous mastitis. There's going to be mastitis associated with TB itself. And I think, yeah, these are the non-lactational mastitis which are basically seen, and then details of this is not that high yield, so we do not need to know that. Then for ductal ectasia basically means that there's going to be dilatation of the duct itself. Because of this dilatation, it is going to be filled with debris, and then this debris can act as a source of irritant. It can cause irritation. It can also lead to periductal mastitis, or we can also call as periductal inflammation. So there's going to be inflammation in the surrounding area. It is going to be causing irritation, and it is also going to lead to the nipple retraction. So there are 3 things associated with ductal ectasia. That is going to be irritation, periductal inflammation, and nipple retraction. Because of this discharge, because of this debris, there's going to be discharge. The color of discharge in ductal ectasia will be green, brown, or muddy colored. So for treatment, what you will do is that there's going to be triple examination to rule out malignancy. Then antibiotic therapy is given in order to basically prevent the growth of bacteria within this debris. Then there's another disease that is called as the Mondor's disease. So what happens is that on the anterior chest wall, alongside with on the breast, there's going to be the veins which is called as the thrombophlebitis of superficial veins of breast and the anterior chest wall. तो उसमें क्या होता है कि जो ब्रेस्ट होती हैं उन पर सुपरफिशियल वेन्स प्रेजेंट करना शुरू कर देती हैं. तो इन ऑर्डर टू एक्चुअली रीच दैट यू रिस्ट्रिक्ट बॉडी मूवमेंट्स. आर्म मूवमेंट्स को भी रिस्ट्रिक्ट किया जाता है, बॉडी मूवमेंट को भी रिस्ट्रिक्ट किया जाता है, एंड विद इन अ स्पैन ऑफ फ्यू मंथ्स ये ठीक हो जाता है. तो इसे आप कहते हैं मॉन्डर्स डिजीज़. सो या दैट्स इट फॉर दिस